Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
All right. So your time for the next stand starts now. Have a look at this slide, guys. Now, so guys, the very few responses this time. I was expecting more. Only Swaroop has answered, I guess, up till now. It's not that difficult a question, guys. I'm discussing this answer now because of the time has already gone. Identify the type of anemia. Please, everybody should be able to identify. It's sickle cell anemia. Okay. You see the sickle cell shaped. Okay. And then you have the abnormal cells are also there. Then recommended treatment options. This is folic acid supplementation. Hydroxyurea is avoided in pregnancy. Prophylactic antibiotics, oxygen therapy. These are the recommended treatment options in the antenatal period. That means in pregnancy, you will avoid hydroxyurea, but you can keep giving blood transfusions. Prophylactic antibiotics like penicillin is usually given. Oxygen for crisis, and folic acid, high dose folic acid is usually given in sickle cell disease. Write the dose and duration of any two drugs used in this condition. So in pregnancy, please don't write hydroxyurea. Most of you have written out hydroxyurea. That is to be avoided in pregnancy. So the answer will be high dose folic acid, which is 5 milligrams throughout pregnancy, and prophylactic antibiotic, that is penicillin. Usually now you have a tablet. So 250 milligram twice daily continued throughout the pregnancy to prevent the infection. So that's the answer. Penicillin tablet now you have 250 milligram twice daily. Then the question was, what are the conditions that should be avoided for preventing complications? Remember, guys, sickle cell crisis is horrible in pregnancy. So that is usually compensated by hydration, hydrating the patient, oxygen supplementation, prophylaxis, and venous thromboembolism prophylaxis. So how to prevent this kind of complication? You will avoid dehydration, you will give oxygenation, you will avoid any infection in pregnancy, and extremes of temperature usually causes the sickling crisis, and you will avoid that as well during pregnancy. And that is the answer for this question. All right, guys. Everybody, please be sure this is not a very difficult question. And then what is the inheritance pattern? It is autosomal recessive. Okay. It is autosomal recessive inheritance pattern. It's a very, very famous, what do I say, condition. And I want you, because there's so many questions based on this, I can keep asking on and on and on. So please, this is the answer. Okay, hydroxyurea, everybody, please remember, do not write down hydroxyurea. Never give hydroxyurea in pregnancy because it's a teratogenic drug. All right, guys. So let me see. Okay, I'll take one more, and then we can call it a day. Okay, that's the one. Let's start answering. And the time starts now. All right, guys, let's now discuss the answers. Most of you are right, as usual. All of you have a very good sound knowledge, and you're also applying it at the right time, in the right time frame. Please make sure that you're always labeling your answers, okay? The instrument is actually the uterine forceps. We call it the Kelly's, wait a second, Kelly's uterine forceps. And that's it. And its uses, of course, to measure the depth of the uterine cavity and guide the placement, okay? Mention the two contraindications. Remember, sepsis, post or post-delivery sepsis. Okay, acute pelvic infection or sepsis will be the right way. Wait. Sepsis will be correct to write down. Sepsis, an active pelvic infection, is absolutely contraindicated. Uterine abnormalities, it is contraindicated. It is also one more condition I'll tell you. After 48 hours and before 4 weeks postpartum is contraindicated. Okay, that's one more contraindication. Now, what are the limitations? The limitation is that of you can have uterine perf, you can have menstrual cramping, bleeding, expulsion of the device. Many of you have written down infection, unexpected bleeding. All are correct. Absolutely right. No problem. Okay, guys. So thank you so much, guys, for being my, these active, agile students, always, pumping up the energy of the class. Thank you, everyone who has participated.